and NICU. And I'll let Michelle introduce herself.
Hi, Hannah. I'm Michelle Carter. I'm the clinical nurse specialist in the OB department. And my field is mother baby, postpartum, labor and delivery, and then high risk antenatal.
Okay, cool.
So-
Well, hi, you guys.
So Michelle will go over labor, an OB questions with you, and I will go over pediatric focus questions. Okay.
Okay.
All right. Any particular section you want to begin with? You want to start with a peds or an OB?
It doesn't really matter to me.
Okay. So I'll start with the peds question. Okay.
I can learn too.
Okay.
Right. Okay. Here's the question. A topical corticosteroid is prescribed by the healthcare provider for a child with contact dermatitis, otherwise known as eczema. Which instruction should the nurse give the parent about applying the cream? Number 1, apply the cream over the entire body. Number 2, apply a thick layer of cream to the affected areas only. Number 3, avoid cleansing the area before application of the cream. Number 4, apply a thin layer of cream and rub it into the area thoroughly.
So we want the right answer, right?
Correct.
Okay.
If you want to go through each of them, then I can read them again, and you need to do is focus on the subject, okay? And the subject is the application of the corticosteroid, right?
Right.
Okay, so sometimes it's helpful to go through questions and eliminate answers that are incorrect. So let's go through those again so that you can, all right. Apply the cream over the entire body.
No.
Okay, that is correct. Apply a thick layer of cream to the affected areas only.
Possibly. Maybe. I don't think thick, but
Okay, then that sounds like a no.
okay.
Avoid cleansing the area before application of the cream.
False.
Correct. And apply a thin layer of cream and rub it into the area thoroughly.
I think it's that one.
You are correct. So you want the number 3, avoid cleansing the area. That one you would eliminate first because it doesn't even make sense, right? Not to clean the area before applying a cream. All right. And then number 2, the trigger for elimination was the word thick, which you identified. So good job. Okay. And of course, the correct answer is number 4, applying a thin layer of cream. Okay. And it is important to apply steroid creams sparingly. You do want to rub it into the area on clean skin, right? So you would clean the skin before application, okay? And you really limit the application to the affected area, all right? So there you go. I'll let Michelle give you a question now, an OB question. I just went through a label piece. I don't know if you had some OBs.
I do not. Yeah, I just wanted to go read. I don't have a book. Hi, sorry, Hannah. I thought we were probably just going to talk about some different questions, but then just some different concepts in OB that are definitely important concepts to know. And I have not had exposure to any NCLEX questions, so.
Okay.
Let's see. Just the reproductive system. I don't know. Do they get? I mean, it might get us a lot of things. Who knows, right?
Yeah. All right. Sorry.
Yeah, we can just keep doing peds right now.
Okay.
Flip over
Okay.
to OB if you want to.
All righty. Okay, so here's another peds one. And really keep in mind that this is about learning really how to focus on the subject of a question and how to eliminate answers that, will get you to the correct answer.
Yeah.
Right, let's see here. Okay, The nurse is instructing the parents of a child with iron deficiency anemia regarding the administration of liquid oral iron supplement. Which instruction should the nurse tell the parent? Number one, administer the iron at meal times. Number two, administer the iron through a straw. Number three, mix the iron with cereal to administer. Number four, add the iron to formula for easy administration.
So with iron, you want to take it with a straw because it can stain teeth.
Exactly. Tell me why you wouldn't want to add it to the formula. It would make it easier to give, don't you
Because
think?
you're not supposed to add anything to formula. That's not good. That's all. I mean,
Exactly.
it's
Yeah, good job. Okay. And then why wouldn't you want to mix it with cereal?
um, it just sounds like a weird thing to do. That's not something I would
Yeah, it
even
kind
tell
of
anybody to
seems
do.
you wouldn't mix it in formula, right? Because,
Yeah,
yeah, you would not know how much of that medication was not given if they spit the cereal out, right?
right.
Okay, good job. All right. Um, no, it's Melissa. She texted out if we wanted to use the book.
Yeah.
I didn't know if you get questions prepared or anything. All right. Let's see. Okay. Okay. Here's another one. The nurse is monitoring a child for bleeding after surgery for removal of a brain tumor. The nurse
Okay.
checks the head dressing for the presence of blood and notes a colorless drainage on the back of the dressing. Which action should the nurse perform immediately? Number one, notify the surgeon. Number two, reinforce the dressing. Number three, document the findings and continue to monitor. Number four, circle the area of drainage and continue to monitor.
Notify the physician.
Okay, and tell me why. Why did
Well,
you?
because it could be CSF fluid.
Exactly, exactly. Great job. Um, let's see. And then obviously options 2, 3, and 4, they're not immediate actions because they do not address the need for immediate intervention. So
Yeah.
okay. I'm going to do one more and then give us a couple minutes to flip to some OB, okay?
Okay.
All right. Okay. The nurse provides a teaching session to the nursing staff regarding osteosarcoma. Which statement by a member of the nursing staff indicates a need for information? Number one, the femur is the most common site of this sarcoma. Number two, the child does not experience pain at the primary tumor site. Number three, limping, if a weight-bearing limb is affected, is a clinical manifestation. Number four, the symptoms of the disease in the early stage are almost always attributed to normal growing pains.
Read the question again, please.
Yes. Okay. Focus on the subject. Where did it go? The nurse provides a teaching session to the nursing staff regarding osteosarcoma. Which statement by a member of the nursing staff indicates a need for information? In other words, they don't quite understand it. They need more information.
Okay. And then what are my options?
Okay. Number one, the femur is the most common site of this sarcoma. Number two, the child does not experience pain at the primary tumor site. Number three, limping, if a weight-bearing limb is affected, is a clinical manifestation. Number four, the symptoms of the disease in the early stage are almost always attributed to normal growing pains.
I think it's either 2 or 4.
Either 2 or 4. Okay, so why do you think it is number 2? And I'll read that over again.
Okay.
2, the child does not experience pain at the primary tumor site.
I go 4. I'm going 4. But
Okay, all right.
I can't. I know the osteosarcoma. That's like a cancer, right? But I can't.
Yes,
I
yes.
can't tell why I know. I don't can't tell why
Okay, okay.
I think that.
Oh, okay. So the answer is regarding the pain. So
Okay.
child does not experience pain at the primary tumor site. Okay. So osteosarcoma is manifested clinically by progressive, insidious, and intermittent pain at the tumor site. By the time these children receive medical attention, they may be in considerable amount of pain from the tumor. Okay. And then
Okay.
the other options are all accurate regarding osteosarcoma. So this was,
Okay.
you know what I mean, would indicate the nurse needs more teaching. Okay. So,
Okay.
um, yeah, but all the other ones were all correct. Okay.
Okay.
So osteosarcoma. All right. Okay. Give us a couple minutes. Okay.
Sure.
All
That's
right.
fine.
Okay. Let me just.
Yeah, the answers and stuff. I'm
Uh-huh.
sure.
Yeah. If I'm not going to answer the question wrong, darn it.
There's so many
It's a
pages.
lot.
So
You know,
have you had
my
a chance to
stuff-
look through, like, do you have an NCLEX review book at all?
I'm using UWorld. I'll do like 20 questions. I try to do it at least 3 times a day, but it's
Okay.
turning out to be like twice a day. But then I have the point for Lippincott. Um, I haven't used that as much, but I do have it available to me.
Mhm. Okay. So, Hannah, one of the things, so did you guys learn much at all about, like when in your maternity rotation, about, fetal heart rate and that kind of stuff at all? Did you guys talk about that much at all?
No, we did, but when I read the strips, like I never really like I don't know what I'm looking at most of the time. Like I know the waves are like contractions, but like
Okay.
um it's just hard to tell like what's going on, I guess.
Right,
I never really
right.
absorbed it, I guess.
So, okay, so this first question was gonna ask about, it's about fetal heart rate. And, so you're thinking about your pregnant patient who is, so this pregnant patient is 38 weeks gestation. And you note that the fetal heart rate is 174 beats per minute. So what would you be your first priority nursing action with this type of, situation? So knowing that, I guess I would ask you, when you think about the fetal heart rate so the first thing to think about is 38 weeks, right? So is she full term? Is she preterm?
38.
Yeah,
Um, I think that's full term, right?
correct. Good. Yep, because
Okay.
remember, full term is up to 40 weeks, and then so 37 to 40 is kind of like your full term. Um, and you have like late preterm, all those kind of things. I don't think they're asking questions about that, but just knowing that 38 weeks is kind of near the end of her gestational period. Okay.
Okay.
And then a fetal heart rate of 174 beats per minute. So when you read that, what does that initially tell you?
Well, if I'm not mistaken, the normal fetal heart rate should be in like the 160s, right? So 170 isn't like too concerning, I guess, but like it might be borderline.
Okay. So no, it's a good thought because sometimes it's hard to remember all those different numbers. But so a normal
Yeah.
rate would be like 110 to 160 is normal.
Oh,
So
110 to 160. Okay.
yeah. So anything outside of that range, then would you be concerned about probably?
Well, yeah.
Yeah. Sure. So if you had a heartbeat of 174, so what would you be your priority nursing action? Would it be one, document the finding? Two, check the mother's heart rate? Three, notify the obstetrician? Or four, tell the client that the fetal heart rate is normal?
Um, you want to notify the obstetrician, but I mean, I probably first I would tell her to change positions to see if that's going to help.
Right, right. So, but your priority would be out of those choices then, so you can definitely eliminate, you would just document and do nothing further, you would eliminate that one.
No, yeah, no, you're not going to do that.
Totally. And then you wouldn't tell the client that that fetal heart rate is normal because it's not, right?
No, right.
Right. So obviously then, so check the mother's heart rate or notify the obstetrician. So based on this, your priority action is obviously to notify the physician that this is the heart rate. That
Okay.
is 174, okay? But you're right, it isn't the obstetrician. So I guess when you look at a question, like look at all the different parts of it too, right?
Yeah.
Like, so think about the gestational age, the heartbeat, and then what is your concern if you were ever to see that at that point?
Cord compression is probably be my number one,
Well,
right?
so remember in cord compression though, when you're thinking about cord compression, you're slowing the amount of blood flow that gets to the baby. So therefore, you're usually going to have a slowing of the heart rate.
Oh, okay.
So like a heart rate of 174 is high. It's high for a baby to be 174.
Yeah,
So that's our
right.
norm. So we
Okay.
need to notify the doctor then. Okay.
Okay.
Let's see, there's some other questions here too. This is a great book. This is a good question. Oh, yeah, yes, I could have known that one question. Yeah. See, what else would be an important question to ask? I'm not sure how much they'd ask you about prenatal visits and stuff. I don't know if they'd really ask you much about that because did you guys learn much about prenatal stuff at all?
In regards to like what?
I'm
I mean,
thinking
you
more
want to.
like yeah, during your school.
I'm sorry, what? Say that again? Oh, am I cutting out?
No, you're fine. I thought
Oh,
most
okay.
at the time. Um, so I'm thinking probably they're going to ask you things that are maybe out of the abnormal area from pregnancy potentially. So
Okay.
so when you're thinking about like things that are abnormal in pregnancy, right? So what's one of the things that jumps out to you? You think of that's not a normal part of pregnancy.
Bleeding.
Bleeding, yes, that's a primary thing. Perfect. Gosh, that's a great answer. Because bleeding is one of the things you should not have, right? So any person that comes in bleeding, and you've got questions related to bleeding, your concerns are always fetus initially, and then of course the mom and the maternal care. Okay.
Okay.
Someone asked about sexually transmitted diseases, syphilis. Let's see. So one of the things you might hear about, like, okay, so we can do that one, sure. So another thing besides bleeding though, our other concerns in pregnancy is hypertension, right? Because that's not normal, right?
Right.
Normally in pregnancy, you see a little drop in blood pressure in a mom, more so ever than an elevation in blood pressures, okay? So one of those things that we think about, so when you think about hypertension, what is something that jumps out at you about pregnancy? Hypertension.
What's something that jumps out at me?
Yeah, like that you
Um,
assess the patient for probably.
Swelling in the face or like the extremities, I guess.
Yeah, yep, swelling, and preeclampsia. So,
Um,
right,
Protein in the urine, is that another thing too?
absolutely, absolutely. And then just that hypertensive environment for that mom, that baby, which is concerning, right?
Yeah.
Okay, so how about this is a question Susan pointed out, which is a very good question. the nurse is performing an assessment on a pregnant client in the last trimester with a diagnosis of preeclampsia. The nurse reviews the assessment findings and determines that which finding is most closely associated with the complication of this diagnosis. Okay. So number one,
Okay.
enlargement of the breasts, complaints of
No,
feeling hot when the room is cool,
possibly.
possibly, periods of fetal movement followed by quiet periods,
No, that's, well, eh.
right, or evidence of bleeding, such as in the gums, petechiae, or purpura. So number one, enlargement of the breasts. Is that going to be a complication of a preeclamptic diagnosis?
No,
Nope, because that's a normal part of pregnancy, right?
yeah.
And then complaints of feeling hot when the room is cool. Is that something you'd be
I mean,
concerned about with the
when
preeclampsia?
you're, um, not really. I mean, it's a symptom, but
Right, and that's part of normal pregnancy too, right?
yeah,
There's all those hormones and stuff, hot flashes and stuff, totally. And then
right.
in the number three, periods of fetal movement followed by quiet periods. What do you think about that?
It's iffy. I mean,
Right,
depends on the time of day, I guess.
true, but actually during pregnancy, fetal movement followed by quiet periods is normal because your babies are always going to have some quiet periods when they're
Yeah,
sleep cycles, right?
okay.
That'd be normal.
So that would be normal.
Yeah, so when you look at all those things, you're thinking like, okay, that seems like a normal part of pregnancy. And so the last one, if there's a little bit of bleeding at the gums, petechiae, or purpura,
Well, that would be the priority.
totally, yep, because that's one of those things that would jump out at you that's not a normal part of pregnancy, right? And that could,
Okay, yeah.
especially if the patient is preeclamptic, that could be something that is leading to something even worse, such as HELLP syndrome or a worsening of preeclampsia.
Okay.
Okay, good. Good. So when you look at those questions, like I always think like, yeah, what would be like, what's the normal part, right? What's normal? What should I expect? And then thinking like you can narrow it down and pretty much, right?
Yeah.
How about something that would be, let's see, maybe more concerned. All that apply. Alrighty, how about, let's do another one too. So besides preeclampsia and bleeding, two of your biggest things right there, right?
Yeah.
Fetal movements, labor and birth. So labor and birth kind of stuff too. You're not going to be asked much about labor and birth too, right?
On my NCLEX, I did get a lot of OB, and it's been a while, so I don't necessarily remember the types of questions, but I mean, they did have some variability ones, and they had some ones about bleeding. There's placenta previa, and then there's another bleeding one that like the placental abruption. I guess I can never really.
So make sure you know,
I
like,
guess
you know,
I, it's hard to tell the difference between them. You know what I mean? Because they're just so similar.
they're very similar because it's all about bleeding, right? But
Yeah.
if you think about a previous, so always think about your anatomy and always think about the physiology, like when they're asking you questions. So if you've got a patient with a previa, so where is that placenta when you've got a previa?
It's bleeding at this like closer to the cervix, right?
Correct. Yep. It means that the placenta is low lying and it's typically covering the os or covering the cervix. And so therefore,
Okay.
if the placenta's there, it's gonna be bleeding. And it's usually like those things that they always ask you to memorize and remember is that it's painless bleeding because it's just that's
Okay.
from that organ, from that placenta. But then an abruption where the placenta is adhered to the uterine wall and you've got a tearing away of that placenta a little bit, that's painful. So think about like how
Okay.
like, you envision what that looks like on a mom or on a uterus. The tearing away would be painful. So you'd have bleeding also, but it'd be painful bleeding.
Oh, sorry. How can I help you?
That's okay.
Neosporin, first aid, next aisle. Sorry, I'm at work right now.
Oh, that's okay.
Okay. Anyway, so next question.
So what are the questions then? So the nurse is monitoring a client that's in labor. The nurse suspects a vocal cord compression. If
Okay.
if which is noted on the monitor tracing during a contraction. So would you see variability, accelerations, early decelerations, or variable decelerations?
Ooh. Um, if I'm not mistaken, variable no, you don't want variable decels, right?
You don't want them, but if you've got cord compression, so do you have that? You have your veal chop acronym.
Yeah.
So what's veal? Variables.
Variability is cord compression.
Variables. Yep. Variables are cord
Okay.
compression. Yep. So variables
Okay.
with cord compression, and then any kind of like placental insufficiency would be late deceleration. So, but your
Okay.
first thought though would be variable decelerations though with cord compression, right?
Yes.
Yeah. So think of your veal chop, and that's the answer, correct? Because when you think about those other eight, like the other choices, variability is a normal part of the fetal heart rate,
Yeah.
and accelerations are a normal part, right?
Yeah.
Yep. And then early
I just
deceleration.
have a hard time like sorting through all the information in my brain and like making a coherent sentence about it. You know what I mean?
Yeah, and remember it all
It
too.
sounds really silly, but yeah.
So one thing to remember is remember all those little acronyms that you put together to help remember those things.
Yeah.
So so if you think of that right away, veal chop, and in your mind think of, what's the V, the E, the A,
Yeah.
right? So your variables would be associated with cord compression.
Okay.
Alrighty. The chop is the so your variables, early accelerations and lates, and then chop is what it's coming from. Like, so chop is the cord compression, head compression, oxygenation, and what's the P? Um, placenta. Placenta. So the lates and placenta, so veal chops. So one other thing too, so here, let's talk about this too. A client in labor is transported to the delivery room and prepared for a cesarean delivery. After the client is transferred to the delivery room table, the nurse should place the patient in what position? So this is just knowing like your positions and the definitions of the positions. So what position do you know, like off the top of your head? Like, what position is versus Trendelenburg?
Versus um I'm sorry, versus what?
Well, so a Trendelenburg position, so when the patient is laying flat and then tipped down, so the head is down a little bit, that's Trendelenburg, right? What is a semi-Fowler's position?
I'm sorry, my earbuds cut out. I'm just trying to reconnect them here.
Oh, sorry.
Okay. I'm sorry. Repeat the question. I'm sorry.
That's okay. It's just about the positioning of a patient for surgery, for a C-section. And then
For a
just,
C-section?
yep, and then
Okay.
just knowing those different positions, that would be like something you would normally know for any kind of nursing. So what is a semi-Fowler's position?
That's like kind of sitting up. You don't want that.
Yep.
You want them laying flat-ish.
Perfect. So
I mean,
like, what's the nursing definition of a flat position?
um, supine.
Correct. Yep. And that's your answer, the supine position. So,
Okay.
so supine is flat. So what's a prone position?
Prone, that's like on your stomach, right?
Yep, exactly. Trendelenburg is when you've got the patient flat, but the head is tipped down,
Okay.
right? And then semi-Fowlers are sitting up partially, right?
Yeah.
Right. So supine position would be what position you put them in for a C-section. see, what else would be a good thing to ask you about? Okay, do you know what an amniotomy is?
Amniotomy. That's when they test the fluid, like they stick a needle in your belly.
Right, that's
And they
amniotomy.
test for Down syndrome and stuff like that.
Right. So, but that's a good way to think, because when you think of amnio, anything that has to do with amnio is about the fluid, right? So that
Yeah.
particular thing would be an amniocentesis, but an actual amniotomy would be, breaking of the water. Okay.
Oh, okay.
So after an amniotomy, what should be one of the first things the nurses thinks of? So right after the water is broken, what would be one of those first initial thoughts that you would think of? Would you want to check?
Well, what does it look like? Does it have a foul odor?
Perfect. Yeah. Yep. Exactly. Assess that fluid, right? Is it meconium? Is there
Yeah.
is it clear? Is there any odor to it? Perfect. And then, so what would be one of your first things that you need to assess for? Would you check for cervical dilatation? Would you check for bladder distension? Would you check the fetal heart rate pattern, or would you check the maternal blood pressure?
Uh, Fetal heart rate.
Correct. Why do you choose that answer?
Because you gotta make sure baby's okay.
Yeah, exactly. Because once you do the amniotomy, you break that bag of water. We don't know where the baby's going to go.
Baby's gotta come out at that point.
Right. You don't know if the baby's coming right down, or sit on top of the cord, or if the cord's coming down, or if the positions change completely. So definitely checking the fetal heart rate would be the first thing. Right. Very good. Excellent. So yeah, thinking of all those like critical thinking things, right? Picturing what's going on with that patient and then what you would do first. Good job. Good job. Let's see, one more. The nurse has been working with a laboring patient and notes that she has been pushing effectively for 1 hour. What is the client's primary physiological need at this time? What's the client's need at this time? Would you want to do number 1, ambulation? Number 2, rest between contractions?
No.
Number 3, change positions frequently? Or number 4, consume oral fluids and food? What's her primary physiological need?
They're not supposed to have food.
Correct. No eating, right? She's pushing, right? She's been pushing for an hour.
Yeah.
Um,
Um,
would you want an ambulator?
I'd say no, absolutely not.
Good answer. And then,
Terrible
I
idea.
guess you're just left with the last two. Then, would you change positions frequently, or would you rest between contractions?
Rest between contractions.
Right. Very good. Perfect.
Okay.
Because she's already pushing effectively, and she's been pushing for an hour. And so, in your head, when you read this question, you think, "Well, she's been pushing well for an hour, and that's not too unusual because you can push up to 3 hours, right?"
Yeah.
So we want to get her to the point where she's rested enough so that she's able to continue on with that great pushing, right?
Yep.
Yeah. Very good. So rest between contractions so she has that ability to push on. Literally. No kidding. Push on, little whipper. Little whipper stepper. Having too much fun. Good. All right. Do you want to do more pieces up now, or you want to stick with OB? And hand it clip to you.
I don't mind. We can go either way.
Are you finding this helpful at all?
Yeah. I mean, talking through it definitely helps. When I took my NCLEX the first time, I don't think, like, I thought I had the right answer, but then I would just end up changing it just because. But like, I didn't have an actual answer as to why I would change it. You know what I mean? So it's just like,
Yeah.
you're probably wrong. Just do it. And I think that was my biggest problem.
Usually your first answer is the correct one.
I know, but I never trust myself.
You don't want to overthink either. Think about
I remember being wrong all the time in nursing school. I'm just like, you're probably wrong.
Oh, don't think that way. No, because if you're going in well prepped,
Yeah, I
think
know.
of like, think of like, look at the question and ask yourself, okay, what are they asking me? What are they looking for? And kind of,
Yeah.
like I would usually do is answer like I would look at the question and then kind of try and answer it before I even looked at the answer choices. To kind of have an idea of probably what I, what I think is right and wrong. And be
Well, and
alerted to those.
then I mean, I have like some.
Oops, you're
Yeah,
breaking
go ahead.
up.
Oh, can you hear me now?
Oh, Hannah, you're breaking up.
Better? Better?
So far. Yes, yes.
Okay. That's just when I go over there. Okay. So I would get some select all that apply ones that like I would think that like okay, like I wasn't really sure like if it was a right answer or not. So then I would just pick it up anyway.
Oh, right. Right.
So
Those,
it's hard to like even find out what I got wrong. You know what I mean?
uh-huh. Right. I mean, it's easier picking just one answer than having to pick 3 out of the 7, right? Yeah, definitely.
Right.
Right, yeah, for sure. So postpartum questions too. There's some good postpartum things. Let's see. Okay, one of these questions. This is just a 1, 2, 3, or 4. Okay, the postpartum nurse is providing instruction to a client after birth of a healthy newborn. Which time frame should the nurse relay to the client regarding the return of bowel function? So, so basically, right, after she delivers, vaginally, when should bowel function return to normal? So in your head, think to yourself, okay, would it be within a couple days, within a week, within a day? So what are your thoughts when you hear that question?
Should be at least a couple days. I mean, if not, I mean, I would say no more than like a day or two, right?
Right. So if are these answers then if you saw 3 days postpartum, 7 days postpartum, on the day of birth, or within 2 weeks postpartum?
Well, 2 weeks is too long.
Totally. Yep.
No more than so 2 weeks is too long, 1 week is too long.
Right.
What were my other options?
On the day of birth, or within 3 days of postpartum?
Within 3 days.
Yeah. Yeah. Perfect. Yep. Because and it's all like just logical thinking, right? Like probably won't return to normal that very day, and definitely a week or 2 weeks is way too long. So,
Yes.
your last option, 3 days, is perfect. Good. Same. Veal chops, I know. Postpartum complications. So, different postpartum things like, I think they do ask you a lot about postpartum stuff. Do you think like on the test?
I had a mix of like just labor and postpartum, so it was
Mhm.
I had a lot of OB. It was weird.
Yeah.
I didn't expect it.
Yeah. So make sure you review a lot of that, that little like what's normal for postpartum, and then you would know for sure like what's abnormal then, right? So knowing what's
Yeah.
is really important. Um, let's see. So one of the big things they talk a lot about is like hemorrhage, of course. And so let's see. So you've got to assess. You're preparing to care for 4 patients. Which client is most at risk for hemorrhage? A primate who delivered 4 hours ago, a multip. Do you know the differences between a primate and a multip?
Multi, yeah, yeah. There's multiple babies versus one baby.
Correct.
Right? Okay.
A multiparous patient who delivered 6 hours ago, a multiparous patient who delivered a large baby after oxytocin induction, or a primiparous patient who delivered 6 hours ago and had an epidural. So out of those 4 clients, who's most at risk for hemorrhage?
So when you have multiple babies, you're at risk for hemorrhage, but if you have a larger baby, then you're more at risk
Yeah.
for
Yep,
hemorrhage afterwards. So I'm going large baby.
Yep, large baby and also oxytocin. So, because that patient had a large baby and oxytocin, so those are like a couple different risk factors that would put her at more at risk for hemorrhage. So yeah,
Okay.
good, good. You do a really nice job, like figuring out, like, eliminating the ones that are not correct, and then just having a last option on what may be correct, which is good. So one more thing on the assessment of a postpartum patient, the nurse notes that the uterus feels soft and boggy. What should be your initial action? What's the first thing?
So you want to massage it
Yes, good job.
because you don't want it.
Good, perfect. So would you document the finding? Would you elevate the patient's legs? Would you massage the fundus until it's firm, or would you push on the uterus to assist in expressing class?
Massage the fundus.
Perfect. Massage it until it's firm, right? Because when we push
Yeah.
in the uterus too much, we could put her at risk for having a uterine reversion. So perfect.
Okay.
Good job. All those normal expectations. Okay. Okay, one other thing too. Gosh, there's a lot of good questions. Postpartum nurse is assessing a client who delivered a healthy infant by cesarean section. Now you're assessing for signs and symptoms of superficial venous thrombosis. Which sign should the nurse note if superficial venous thrombosis was present? Right. So what do you think? So when you think of thrombosis, what are your initial thoughts? Like, what are you going to probably be looking for?
Thrombosis?
Yep.
Like difficulty breathing or something? Or would that be too late?
Well, yeah, that's definitely a thrombosis, like if it's a pulmonary embolism, right? But make sure
Yeah.
words, a superficial venous thrombosis. So what does that tell you? A superficial venous thrombosis
It's in a vein, right?
is what?
It's in a vein.
Yeah, in a vein. Yep, in an extremity,
Yeah.
right?
I don't know much beyond that.
Right. So, so you're definitely thinking about the extremities, right? And her legs, because that's where they're most
Yeah.
at risk for a thrombosis,
So
right?
looking for swelling.
Yep. Yep. So good. So swelling.
Okay.
But what else are you going to see? Are you going to see a paleness, coolness,
No, it's gonna be red and it's gonna be hot.
red, warm, enlarged, or swollen, right? Right.
Okay.
So your answers would be either pale, like paleness at the calf area, a coolness at the calf area, enlarged hardened veins, or a palpable dorsalis pedis pulse.
Large garden.
Yep, large hardened veins. Right.
Okay.
Right. Perfect. So yeah, when you read your questions, and too, make sure you differentiate. Like, so if they're asking you for a superficial venous thrombosis, they're not asking you about pulmonary embolism, though. They're asking you about like an extremity, right? Perfect.
Yeah.
Good job. Good job. Do you want to do more paid stuff at all? Here are the newborns. Want to do a couple newborns? Want to do some newborn stuff? Yeah. Okay. Well, let's just turn the pages and see what the. Did they ask you many questions about newborn and newborn assessment?
Yeah.
A little bit.
Yeah. Not a whole lot.
Okay.
It was more about mom than
Was it?
anything. Yeah. Oh, thank you. You have to do that.
All righty. Okay. All righty. Hannah, the nurse is assessing a newborn after circumcision and notes circumcised area is red with a small amount of bloody drainage. Which nursing action would be most appropriate? So before I give you the options, just hearing the question, what do you think an appropriate nursing action would be? So it's red with a small amount of bloody drainage.
Bleeding, right?
Yeah.
I guess like
Think about what
I'm-
would you expect to find after a baby is circumcised?
um
I'm going to read the question
I
again.
guess you
And
should
listen-
okay, go ahead.
read it again. Listen for some keywords. Nurses assessing a newborn after circumcision and notes the circumcised area is red with a small amount of bloody drainage. Are you
Bloody drainage doesn't sound nice.
if they were just circumcised? Does that alarm you?
Oh, if it just happened? No.
Okay, does not alarm you. So I'm going to give you some options here, okay?
Okay.
Apply gentle pressure, reinforce the dressing, document the findings, or call the primary health care provider.
Reinforcement dressing.
I'm sorry, what did you say?
Reinforced dressing.
Reinforce the
Yeah.
dressing?
Yeah.
Okay. All right. That is, let's see.
That's the wrong answer.
It's not that it's the wrong answer, but think about the best answer. What are you going to do in that moment? Do you have to reinforce the dressing? There's a small amount. Or can you just document the findings as being expected?
You can document it.
Yes. And keep in mind that a lot of times that is an appropriate intervention, right? So you want to always, like Michelle was saying, think about what do you expect? What would be the normal outcome? If it's a procedure, right? What would you
Yeah.
expect as normal? And anytime there is a cut made, it wouldn't be unusual for there to be a little bit of blood on a dressing, right? Now,
Right.
if that dressing is saturated or you see oozing, that's a different situation, okay?
Yeah.
So let's see.
I think one of those key words too in the question is that when it says small amounts
Yes.
of
Right.
bloody drainage. So when you see those key words
Okay.
like small amount of bloody
Yeah.
drainage, so you know, those are the kind of things that should jump out at you.
Okay.
Okay. All right, let's see. Oh, here's a good one. Let's see. The nurse is assessing a newborn who was born to a mother addicted to drugs. Tell me what kind of findings would you expect to see in a baby born to a mother addicted to drugs? What comes to mind first?
So the neonatal abstinence syndrome, right? Because they're withdrawing from drugs too.
Yep, that's correct.
Okay.
So just off the top of your head, if you think about you're looking at this baby, okay, and what do you expect to see?
Like withdrawal symptoms.
Yeah.
So probably cold intolerance.
How do you see that though? We're talking, think about when you just lay eyes on the baby. You're just observing the baby and you're describing
I mean, they're gonna cry a lot, for one.
I'm sorry?
They're gonna cry
Correct.
a lot.
Constant crying. Very good.
Good answer.
Okay. And what do people try to do when a baby is constantly crying?
What do people do when it's constantly crying? Try to figure out what the problem is, so they stop.
Well, we know what the problem is because we know the baby
Right,
was born to a
okay.
drug addicted mom. So,
Yeah.
yeah. So what other findings would you expect? Would you expect the baby to be lethargic or sleepy?
Yeah.
Well, we just said that babies have,
Well, wait, no, that's
Yeah.
no.
okay.
They're
So
gonna be hyper alert.
they're going to be what?
Like hyper alert, kind of.
Hyper
Like agitated.
agitated, excellent, irritable. That's what I was looking for.
Yes.
So they're not
Okay.
lethargic and sleepy. They're irritable. They're constantly crying. And you have an irritable, constantly crying baby. As the nurse, do you think you're going to be able to get that baby to calm down just cuddling it?
No.
No. So they're difficult to comfort. Okay.
Okay.
So the key is drug addicted, a baby born to drug addicted mom, irritable, difficult to comfort, constant crying. Okay. All righty. Oh. Okay. Okay. The nurse administers erythromycin ointment to the eyes of a newborn, and the mother is asking you, why are you doing this? So how would you, what reason would you give to the mother when she asks why you're administering those eye drops?
To prevent
Or,
an infection. But what kind of infection? Um, I don't remember the name of the infection,
okay.
but is it? No, it's not GBS. I don't. For some reason, I have GBS
Yeah,
in my brain.
so the, what is the concern if the mother has something untreated that could pass to the baby, and be in the eye?
It's one of the STIs. I forget the name of it.
Okay, think about your, STIs. So this
Yes.
ointment is gonna prevent an infection, which is called ophthalmia neonatorum, from occurring. Newborn from a mom who has, what kind of untreated, STI?
Is it gonorrhea?
Yes.
Yeah, perfect.
Exactly.
Okay.
Exactly. Okay. Because mothers don't always know, right?
Right.
If they have it. So let me see here. And it's also required by law. Okay.
Okay.
Yeah.
But one other med too that infants get at birth too.
Yeah.
Yeah, that's a good one too. Is
Uh-huh.
what's the other medication that we usually give all of our babies?
Isn't it vitamin K?
Yeah,
'Cause they
correct.
don't have the
Yes.
Yeah, perfect. Did you know?
intestinal waters.
How would you explain to the mother why you're giving that shot?
Because they don't have the clotting factors to stop bleeding.
Okay.
That's what the vitamin K does, right?
Correct. Yep.
Okay. And
Okay.
more importantly, I mean, you're giving vitamin K because they don't have enough of their own, right?
Yeah.
So they're deficient in the vitamin K. And that will help to prevent them from, having any bleeding. Okay.
Okay.
All right.
Good.
And you know what? That's really important because there are, believe it or not, there are some mothers who may refuse that.
Right.
And it's really important to explain to them because of their, immaturity that
Yeah.
they naturally don't have enough of this. Okay.
Are they allowed to refuse it?
I'm sorry?
Or no? Are they allowed to refuse it or no?
Yes.
Yes,
Is it one
they
of
are.
those things that's required by law? No?
So it becomes really important to
Okay.
understand, be prepared to explain why you're giving these medications to the babies at
Yeah.
birth, right? Um,
Yeah.
yeah, so, okay. All right.
Yeah, because then, so when you think about like if a patient refuses something, which is completely within their right, we have to just make sure we educate them,
Yeah.
knowing why we give this, why it's
Yeah.
important to receive this, and then therefore, if they still want to refuse, they have the right to do that. Then, but at least we educated them about the reasons why we're giving it,
Right.
and what the benefits are.
Right. And then you
Yeah.
document that.
Always document.
Yes.
Yeah.
Oh, here's one.
Um, so yeah, you familiar with RHE immune globulin
Yes.
and what the whole purpose of that is and why we give that?
Yes.
Okay.
So that the mom doesn't create antibodies against the baby, right?
Perfect.
Right.
Okay, good.
Right.
I won't go into that then.
Yeah.
You know,
Yeah.
okay. Very good. And then like one of the things they might ask you about different meds, like to treat, like for instance, postpartum hemorrhage. So when you think about the different meds that we give a mom, what's the main like mechanism of the action and why we're giving that?
The mechanism of action.
Yeah, so like methyl ergonovine, hemabate, carboprost, pitocin, all those kind of things. What are we trying to help do during a hemorrhage by giving those meds?
Oh, stop the bleed.
Yep, stop the bleeding, but then what's physiological? Like, what's the physiological goal?
Like contraction of like get the uterus to contract so that it firms up, I guess.
Right, uterine tone.
Okay, yeah.
Yep, exactly. So if you had
That's
to,
the word I was looking for. I didn't have it.
yeah, and so if your answers were uterine tone or blood pressure or control the amount of lochia or deep tendon reflexes, you're gonna know uterine tone is my goal.
It's tone, yeah.
Yeah, perfect. Good job. Um, let's see what else. So an opioid analgesic is administered to the patient in labor. The nurse assigned to care for the client ensures that which medication is readily available should respiratory depression occur. So when you think about
Naloxone.
opioid,
Yeah.
naloxone, very good. Yep.
I think everybody, even the lay person knows that one now.
Right.
Yeah.
All those
All right.
Good. You're doing great.
You
with
are
this.
doing great.
Yeah.
Good job. All
Well,
right.
thanks.
Is there anything else you can think of that you want to kind of review at all?
Not really. I mean, if I talk through it, I think that's another one of the things I didn't do. I didn't talk myself through it. I was just like, I think it's this one because, when I had a simple, like, I guess I had at least a little bit of an answer as to why, but some of them I just didn't, and I think that's why it fell through.
Right.
Right. So like reviewing like what's normal for a patient and normal for a baby, um, will help you, kind of through that.
Yeah.
And then looking through those questions where they ask those questions and asking like, what are they asking me? What are they looking for with this question? What's gonna be my best answer?
Yeah.
That's a key word, best answer,
Yeah.
right?
Right. That's kind of me.
Okay. Here's a piece. I think this question's probably been on every nursing test. Yeah.
All the time.
Okay.
Okay. The nurse admits a child to the hospital with the diagnosis of pyloric stenosis. On assessment, which data would the nurse expect to obtain when asking the parents about the child's symptoms? So without me even giving you the options, what symptom do you link with pyloric stenosis?
Projectile vomiting.
Exactly. Good job. Yep. And in a lot of these, let's see. Um, okay, here's another one. Because you have to kind of link the disease or the diagnosis, like with the key symptom, right? Because a lot of symptoms, they are common with many things, but you want to know what is that key
Yeah.
thing, right? All right, so here's another
Yeah.
one. The nurse is preparing to care for a child with the diagnosis of intussusception. The nurse reviews the child's record and expects to note which signs of the disorder documented.
The
Okay.
jelly stools.
Child record and express no jelly signs of this disorder. Yeah, well, yeah. And the jelly represents what? What is, it's not like jelly, but it's,
Well,
it's mucus.
I remember that from the ATI book.
But no,
So
yeah, you're right. They are jelly-like stools, which is mucus, right? In the stools.
yeah,
Um,
right.
I think when you say jelly, what also would make it jelly? What needs to be with the mucus to kind of make jelly? I know it sounds so gross.
Blood. Blood is in it.
There you go. Blood and
Okay.
mucus equals jelly stool. Okay. Intussusception. Excellent. All right, let's see. That one. Oh, okay. All right. So the mother of the 6-year-old child arrives at the clinic. The child has been having itchy, red, and swollen eyes. And you note a discharge from the eyes, and you send a culture to the lab, and they diagnose it as chlamydial conjunctivitis. Based on that diagnosis, what you determine that what requires further investigation. Okay, I'm going to go through the list and you tell me yes or no to investigate. Possible trauma, presence of, oh, I'm sorry.
Okay. No, what's the next one?
Okay, presence of an allergy, possible sexual abuse.
Bingo.
What's that?
Bingo. That one.
Yes, exactly. Because that doesn't just appear
That's
in the
unusual
eyes.
for a kid.
Exactly. That's right. Okay, good job. Okay, here's another one. I'm sure this will be on your test too. After tonsillectomy, the nurse reviews the surgeon's post-op prescriptions or orders. Which orders should the nurse be questioning? So without even going through these, you have a post-op TNA, tonsillectomy. What do you never do?
What do you never do?
Yep.
Um,
What's a big no-no? And if you don't know, that's okay. I'm going to go through the list for you now, okay?
okay. Yeah, I
All
want
right.
to hear the option.
Okay. All right. So you need to question one of these orders. Monitor
Right.
for bleeding. Do you need to question that?
No, you want to do that.
Exactly. Don't give milk or milk products. Should you be questioning that?
Probably not.
Okay, good job. Suction every 2 hours.
That one. No.
That's right. Good
Is that your
job.
big no-no?
Okay.
Yes. Yeah. Exactly. Nothing in the mouth. Okay. No
Yeah.
straws. Because the other thing is if somebody is, if you think about it, if they're sucking through a straw, right?
Yeah.
It's going to cause some pressure at the back of the
Mhm.
throat, which can it subsequently result in bleeding. Okay. No
Okay.
suction, no straws. Um, and years ago I learned no red liquids either. But okay.
Oh yeah, because I can tell the difference between blood and whatever. Yeah.
Exactly. Okay. All right. The nurses prepares a teaching plan for the mother of a child diagnosed with bacterial conjunctivitis. If you hear the mother say this, you have to suspect she needs a little bit more teaching. Okay.
Okay.
So, which of these situations would that be? Mother says, I need to wash my hands frequently.
No, you're not going to question that.
Okay, good. I need to clean the eyes as prescribed.
I need to do what? As prescribed?
Clean the eyes as prescribed.
You're not going to question that.
Correct. It's okay to share towels and washcloths.
No, it's not.
That's right.
You're
Okay.
going to question that.
Excellent. Yep. Okay. Um, let's righty. Okay. All right. Mother of a hospitalized 2-year-old child with viral laryngotracheal bronchitis, otherwise known as croup, asks the nurse why the pediatrician did not prescribe antibiotics. Okay. So how would you respond
Okay.
to that, mom? Patient is admitted
Croup?
with croup. Uh-huh. And there's no
Okay,
antibiotics
so
prescribed.
because it's viral, right?
Are you sure? You're asking me right.
No.
Yes, you are correct. That's right. Yes.
Okay.
And one thing in peds, parents always they want a medicine.
Yeah.
They want a medicine. You have a cough, I want a medicine. Have a fever, I want a medicine. So it's really important to be aware that unless there is a bacterial infection, antibiotics are not indicated. Okay. Oh, here's a good one. All right, a 10-year-old child with asthma is treated for acute exacerbation in the emergency department. The nurse caring for the child needs to monitor for which sign, knowing that it indicates worsening of the condition. Okay?
Okay.
All right. So, can you think about what you would be monitoring that would like raise a red flag that this patient's situation is deteriorating?
So oxygen saturation, breath sounds,
Okay, what about the breath sounds?
um, I guess worsening wheezing and stuff like that.
Okay, so
What
worsening
is
wheezing.
that?
Okay, so
There's a word for it and I can't put my finger on it.
okay, I'm going to read through these choices, okay? And you
Okay.
identify which one would be the cause for concern, okay, indicating worsening of the condition. Warm, dry skin,
No.
decreased wheezing,
No, that's incorrect.
okay, pulse rate at 90 beats per minute. It's a 10-year-old.
That was normal. Oh, can you hear me?
No.
Oh, sorry. I said that one's normal.
Yeah, okay, respirations of 18.
And a 10-year-old?
Yep.
Hmm. 18 is normal.
And I remember that they're looking to see which of these signs indicate your patient is worsening.
All right, so I picked 3. The heart rate.
The heart rate? Okay. Well, warm, dry skin is normal, right?
That's normal. Right.
Yeah. Your pulse rate of 90 for a 10-year-old, that's not cause for concern. Okay.
Okay.
Respirations are normal. It's the decreased wheezing. Now,
Oh,
yes, because if the wheezing is decreased, so too is the air exchange, right?
yeah.
Wheezing is a breath sound. So if you're not hearing, the asthmatics come in, they're wheezing, okay, you want to get those, you want to dilate the bronchioles so that air exchange can occur, all right, under a less stressful situation, all right? But wheezing in and of itself is not a bad thing, all right? But if you have a patient who was wheezing and now they're not wheezing, that's not good because now they're not moving in the air. Does that make sense?
Yeah.
Okay, let me see if this can be explained a little bit better. Yeah, decreased wheezing in a child with asthma may be interpreted incorrectly as a positive sign when it may actually signal an inability to move air. A silent chest is an ominous sign during an asthma
See, I
episode.
knew that one.
With
I knew that one. Okay. The silent chest.
treatment, yeah. So with treatment, increased wheezing actually may signal the child's condition is improving. Because usually when they come in, they're tired and they're having a hard time moving air, right? Warm, dry
Yeah.
skin indicates improvement of their condition because usually they're diaphoretic because they're working hard to breathe. And the normal pulse rate is 70 to 110, respiratory rate 16 to 20. Okay. Let's see. Oh, okay. Here's another PEDS one. The nurse is closely monitoring the INO of an infant with heart failure who's receiving diuretic therapy. The nurse should use which most appropriate method to assess urine output. So, without me sharing the selections with you, you have a baby, infant, and heart failure and diuretic therapy. What do you think is the most appropriate way to measure urine out or assess urine output?
I immediately think daily weights.
To assess urine output?
Oh, for urine output. Yeah.
What
Okay.
did you say?
I mean, I don't know. Oh, don't you have to do it by? No, I don't know. I don't know.
Okay. How do you think, what would be the best way to measure urine output in a baby?
I don't
Where
know.
would you, where would you find their urine after they pee? Where does it go?
And the diaper. Oh, weigh the diapers. Duh.
There you go. Good. Okay, weigh the diapers. That's right. Okay. Excellent. All right. Um, oh, okay. Pediatrician has prescribed oxygen as needed for an infant with heart failure. In which situation should the nurse administer the oxygen to the infant? Okay. Remember, oxygen as needed. So, should you give it when the baby is sleeping, when you're changing the diapers, when the mother's holding the infant, or when drawing blood for electrolyte testing?
So you're gonna administer the diaper when they're gonna be agitated, right?
I'm sorry?
Um, you're gonna want to give the oxygen for times when they're using it up, obviously. So what are my options again?
When they're sleeping, when the diaper's being
No.
changed, when mom is holding the baby, or when you're drawing blood.
It's either diaper change or drawing blood.
Okay. And why did you
I
pick
say
those?
draw blood.
Okay. Why did you pick that?
Because it's a painful thing and it's
Right.
stressful.
Okay. And how will the baby demonstrate that to you? How do you know that that will be a stressful situation?
They're gonna start crying.
Exactly. Good. Good. And they're gonna use up more oxygen, right? So
Yeah.
that would be the appropriate answer. Good. All right. Okay. Nurse is providing discharge instructions to the parents of a 2-year-old who had an orchiopexy to correct I can never pronounce it, kidism. Which statement by the parents indicate the need for further instruction? Okay.
Okay.
I'll check his temperature. I'll give him medicine so he'll be comfortable. I'll check his voiding to be sure there's no problem. I'll let him decide when to return to his play activities. So which of those statements says, oh, this mom's
It's
not paying attention?
cryptocorticism.
Yeah. But we want to know which statement by the mom indicates that she needs a little bit more education. She says,
Well, kiddo's not gonna decide when he can go back to.
exactly. That's right. Good. And that's kind of like a developmental, age appropriate.
Yeah.
Yeah. Okay. Okay. The nurse is reviewing a treatment plan with the parents of a newborn with hypospadias. Which statement by the parents indicates their understanding of the plan? All right.
Okay.
Caution should be used when straddling my infant on a hip. Vital signs should be taken daily to check for bladder infection. Catheterization will be necessary when my infant does not void. Circumcision has been delayed to save tissue for surgical repair. Which of those statements suggest to you the parent understands the plan?
The circumcision delayed.
Exactly. Good job.
Okay.
Let's see. Okay. The nurse notes documentation that a child is exhibiting an inability to flex the leg when the thigh is flexed anteriorly at the hip. Which condition does the nurse suspect? Okay. Meningitis, spinal cord injury, intracranial bleeding, or decreased cerebral blood flow?
Hmm.
I'm gonna make it a little, I'm gonna paint a better picture. So, when you are lifting the legs to change a diaper, and let's say, you can't, see, is that a good example? Yeah, you might even see this if you're trying to lift legs to change a diaper. On a
Yeah.
sick baby.
So,
Well,
can we
yeah,
repeat the
so,
question?
sure. The nurse notes documentation that a child is exhibiting an inability to flex the leg when the thigh is flexed anteriorly at the hip. So which of
Okay.
these conditions are you concerned about? Decreased cerebral blood flow. Let's look at that one. If a patient had decreased blood flow to the head, would that be a manifestation?
No.
No. If they had intracranial bleeding, would that be a manifestation?
No.
Okay. Would they be able to flex their leg if they had a spinal cord injury?
No. So that one.
No, they wouldn't. Okay, but that would be expected, right? And that leaves meningitis.
Oh.
Okay, so if you remember when if there's a couple different a couple different things you would note on assessment. I think what most people think about is when you're flexing the head, right? Or you're not able to because the meninges are inflamed. Okay, patients won't be able to do that, and likewise with the flexion in the leg there.
Okay.
Okay. So, all right. Um, okay. The nurse is creating a plan of care for a child who is at risk for seizures. Which interventions apply if the child has a seizure? So, if you are taking care of a patient and you're making a care plan, they're at risk for seizures. What are some of the things you want to include in that care plan? You can tell me what you think.
Added side rails. You want to have suction at the bedside, oxygen at the bedside. You want like a low stimulation environment. You
Okay.
want in like a
You know
quiet
what,
environment.
Hannah, I'm sorry. I left out another part of the question because I'm trying to
Okay.
do this quickly. Let's do it this way. Which interventions apply if the child
Yeah.
has a
I
seizure?
got it. Thanks. Yeah. Sorry.
Okay. Right. So which
Oh,
of these
they went.
interventions
Okay.
are you okay?
Yep, we're good. Okay, sorry.
Which of these interventions apply if the child has a seizure? Okay. Documenting the time of the seizure, is that a yes or no?
Yes.
Yes, timing is important. Restraining the patient?
No, you don't want to do that.
No, good. Stay with the patient?
Yes. You want to do
Yes,
that.
exactly. Place them in a prone position?
No.
No, okay. Move furniture away from the child?
Well, yeah.
Okay, good. And then insert a padded tongue blade in the child's mouth?
No.
No, that's right, good. So what you're doing is you're creating, if they do have a seizure, you want to make sure they're in a physically safe environment, right? And part of
Yeah.
that is staying with them and noting the time of the seizure. All right, let's see. I might have gone through all of them. Um, I might have gone through all my questions that I kind of.
Do you have any questions for us, Hannah?
Yeah.
Um, not really. Not right now.
Yeah, Hannah, like for pediatric questions, knowing growth and developmental milestones is really important, okay? And it's really hard to
Okay.
memorize them all. But if
Yeah.
you think of key milestones and when they are expected, okay?
Okay.
That's super important because that's gonna allow you to determine many things, surrounding safety, how to administer medications, language to
Mhm.
use, how do you teach a patient, and how do you help a parent know how to take care of the patient when they are home. So that would be a key thing I would say in PEEPs. And also
Okay.
making sure, because you have your patient, but the patient is dependent on the parent. So you really
Yeah.
are assessing your parents, right? For their ability
Mhm.
to understand the problem, understand what the treatment plan is, and make them part of that treatment plan as well. Okay.
Yeah.
So do you have any like peds related questions? Family related
Um,
questions?
do you have any like tips or tricks to memorizing those milestones for like 18 to 2 months, or you know what I mean?
Yeah.
Like,
As a matter of fact, I have something in my office that I can give you. And it's from the
oh,
CDC.
okay.
Yeah, yeah. And yeah, you're here today?
I'm not. I'm not there until the weekend, actually. My preceptor only works
Okay.
on the weekends, unfortunately.
Okay, okay. So, and when are you here at all during the week or no?
No, but if I have to make a special trip out there, I can. It's not a big deal.
Well, so what I will do, Hannah, let me share with me your email, and I will send you a CDC link, because
Oh,
I think
okay.
everything that's in that written little thing I have, it would be on their website. You know what I'm saying?
Oh, okay.
Um,
Yeah.
so yeah, Hannah, go ahead with your email.
So it's H and then my last name. So HGLE, F as in
H,
Frank, KE,
okay, I'm sorry.
two six. Sure.
Okay, I'm sorry. HG, that's as far as I got. E,
And then LE, yep,
okay,
F as in Frank, KE,
AE,
KE. K is in keys.
yeah. Okay,
And
all right.
then it's four numbers, 2636.
2636.
Yep, at gmail.com.
Uh-huh. Okay, I'm going to repeat that back. Um,
Uh-huh.
it doesn't matter uppercase, lowercase, well, they're all lowercase.
No.
Okay.
Yeah.
H, H as in Harry, G as in goat,
Uh-huh.
L as in lion, E as in elephant, F as in Frank, K as in kangaroo, E as in elephant. Two, six,
Got
three,
it.
six. Oh, good. Okay. I will send you at some point today the email link. Okay. To
Okay, awesome.
yeah, yeah. Another place you can get some good information too is through the state of Michigan Department of Health and Human Services. They
Oh, okay.
they have a lot of materials too.
Okay.
But
Cool.
yeah, because if you can just remember, everything, whether it's pediatrics or like Michelle said, OB, you have to know what the norms are, right? So, because
Yeah.
how do you pick up variations from normal if you don't know what normal is?
Yeah.
And then you have to kind of like sort of triage those variations, right? How urgent,
Right.
right? What is urgent, and things that are not urgent, if they do have a choice to document, then you document, right? Not
Right.
everything requires more than that. So, and
Yeah.
if you always think about patient safety is number one,
Yes.
Number one, you never leave a patient, you stay with the patient. Those are just some things that I even remember from many years ago. Stay with the patient. Anything related to safety, safety is first. Let your patients and parents be part of the planning. Yeah.
Well, thanks so much, guys. What
Oh.
what time does this go till? It goes till 12:30, right?
Yeah, yeah. So I
Oh,
hope you
okay.
found
I
it
just don't want to
helpful.
keep you if you guys got stuff to do.
Yeah.
Yeah, so Hannah, if there's anything else that you need, we should just like provide to you, like our email addresses too. If you have anything, just reach out to us. If you wanna talk or meet in person or go over some things, I'm
Oh,
happy
okay.
to, whatever would help, whatever would help.
Okay. Great. Now can I get your emails from the like link from the meeting itself? Or do I
They
like
should,
should I write them down?
Oh, yeah.
they should be on the appointment.
Okay, cool.
Yeah. And then, you know what I'll do, Hannah, when I send you that link, you'll have my email and I'll put Michelle's in there too. So you'll have that as well, okay?
Great. Thank you so much. Thanks for spending the time with me.
You're welcome.
You're welcome, Hannah. Good luck, okay?
Thank you.
Trust
Have a good day,
yourself.
guys.
Okay.
Oh, I know. I'm getting better at it now.
Yeah. Okay. All right. Have a good day.
Thank you.
Bye.
You too. Bye-bye.